to fight back and win the war against the winter blues. Dr. Greg Hammer is here to share how his tried and true mindfulness practice that will help boost your mental resilience and help you thrive in the cold winter months. Welcome, Dr. Hammer. It's good to have you on the show.
Great to be with you.
You know, it happens to all of us. What is it about the winter that makes us all feel a little more prone to anxiety, depression, maybe even burnout?
I think there are three general causes. One of them is we're not exposed to as much light. Light has a very powerful effect on our physiology and our mood. For example, we know that blue light is activating. That's why we should avoid screens proximate to the time of going to bed because of the blue light. Red light also has significant physiologic effects. People use it to treat skin conditions, eye conditions, and now general wellness. And beside the diminished light, we often are not outside very much. And I think that nature is so crucial to our sense of well-being. It gives us the understanding that we're part of something larger than ourselves. And beside light and not enough time outside in nature, which also limits our exercise in some cases, I think the other thing is that the holidays can be stressful and a source of discomfort, disappointment, and even pain when loved ones who used to be there are not present.
Looks like you're in a room that's pretty well lit, and that's a good thing. So the decreasing light obviously plays an effect. So staying indoors plays a big role too, right?
Well, I think both because of diminished exposure to the full spectrum of sunlight. And also, as I said, I really think getting outside is so crucial for our sense of well-being, just being among the trees and flowers and other growth, and also getting that exercise. So, recommend really if you're indoors, try to get outside as much as you can. If you're working indoors, particularly at home, get out and walk around the block a couple of times during the day. Get the exercise, get the exposure to nature and sunlight.
How do you define winter burnout? What is it, and how can we fix it?
Well, I think winter blues is sort of a mild mood disorder. It's not significant enough to be called depression. That would be an affective disorder. But I think it's a mood disorder associated with those three issues, among others. And I think it's really important to focus on the basics of our physical and mental well-being during the winter especially.
You have a message on taking just 3 minutes a day can improve negative thoughts, rewire our brain. How do you do so?
Well, I practice and teach a mindfulness meditation called the GAIN method or GAIN practice. And GAIN is an acronym for what I think are the 4 pillars of happiness. And they are gratitude, acceptance, intention, and non-judgment. So the GAIN practice in the morning, we get up, we open the blinds, we do our morning hygiene, we find a comfortable place to sit, close our eyes and focus on slow, deep, deliberate breathing, and then just do a self-guided tour through those elements, that for which we're grateful, perhaps something uncomfortable we can bring into our heart and rest into that understanding, intention to really focus on what's happening around us at the present moment and train ourselves to be better at that. And the end in GAIN being non-judgment, learning how to let go of judgment of others, the world, and particularly ourselves. And then we return to the slow, deep, deliberate breathing and open our eyes, and we're ready to go out in the world.
Very timely message. I personally have gained a lot from this myself. So thank you, Dr. Hammer, for being with us. The information right there on your screen. You can follow him right there. Thank you so much.
Pleasure.